One of the best things you can do to help take care of your lower body is do some hip stability strengthening exercises. A lot of times people neglect strengthening of the hips and they worry about strengthening the quads, but we can control the knee very well from the hip. So what we're going to show now is Katie doing a series of hip stability mini band exercises that we get a lot of our patients and our athletes to do, and we want to show you how to do it, so make sure you're doing it correctly. So the first one Katie is going to do is we call Cowboy Walks. She's got a band around her ankles. She's in a good position, her butt's going back, and really working on keeping her stomach tight and her toes pointing straight ahead. What you also don't see is you don't see her coming up and down. She stays in the squatted position. She's going to go forwards there, and now she's going to come backwards. If you're doing this as part of rehab, I'd like you to go, forwards and backwards, 10 steps each one. If this is before you're going to compete, maybe just doing 5 repetitions is enough to activate it. So now Katie's going to face us, and we're going to do the lateral slide. So she's down in a good position, and if her foot comes 6 inches in, the other foot goes 6 inches out. Staying nice and down, keeping her knees spread apart, good level shoulders, and she's not swaying too much back and forth. So you'll go about 10 strides one direction, and now Katie, you can come back and go 10 strides the other direction. You can order these bands online or pick them up at your Dick's Sporting Goods or anything like that. Good. Now we'll let her rest there for a second. And now we're going to do kind of a star reach with the bands. So I'm going to have videotape her from the front here. So to go straight out to the side first, Katie. So her left leg here, we don't want that knee coming in at all. So I like her keep it, there you go, she keeps her knee out. She doesn't come up and down. She's going to do 10 reaches to the side. The stance leg is the one doing all the work. Now let's go the other way. And you just barely touch that moving foot. It's just a tap, and you don't want to sway. She's moving a little bit, so we'll work on keeping her right knee out better. Good. She's showing what we're not supposed to do. That's very good. Now let's go straight back for me. Just do about 5 repetitions so we don't wear you out. Here's 1, 2, 3, good, tight stomach. Now let's go to the other leg. Good, really work hard on keep that right knee out. And then we're going to go back at a 45-degree angle. By now she's already feeling it in her glutes and she's feeling it in her quads. It's a way that we can help strengthen up the hip cuff. If somebody has a shoulder injury, we work on strengthening the rotator cuff. Well, both of these, the hip and the shoulder joints, are ball and socket joints. So at the hip, we need to work on strengthening up the hip cuff. Very good there. And then the last one we're going to do is the Charleston. So she's going to pull the band up just above her knees. Feet are going to be shoulder width apart. And get your feet a little closer together, and she's going to squat down. Good. Now move 10 on the right. Good. We can just do 5 for video's sake. But I'd like you to do 10 when you do this, and then 5 with the other one. So the stance leg is the one that's doing all the work that's not moving. And then 5 both for me. 1, 2, 3. Good. So that's our hip stability mini band series that we like to do at Holt Physical Therapy. If you have any questions, feel free to check out our website. Katie, you can turn around. There's all our information right there. You can give us a call at our phone number or go ahead and check out our website. Thank you.